You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Thanks for tuning in to another episode of the Expert Guide to Parenthood podcast with your host, Christy and Freya from Parents You've Got This. This week, we're going to be talking all about your kids' teeth. How do they come up? Is teething really a thing, and how do we clean them? We have Dr. Alex Zelmanovich here, our dentist, here to talk to us all about kids' teeth. Now, we are super grateful to him. He is one of the partners at the South Melbourne Dental Group where we both go. He's the best. Yeah. And it's a family clinic, so he really can cater for whatever the needs are of your growing family. So, Alex, thank you so much for spending your time with us today. Let's start from the very beginning. So in our little babies, when does teething first start?
So teething normally begins when the first front teeth come through, and generally we expect that to happen at about age 6 months, but we allow for sort of the 4 to 12 month mark, and that's usually within the realms of normality. Some rare cases fall outside that range, but that 6 month milestone, expect to have a little bit of grief. Yeah.
And so is teething really true, Alex? Does it really hurt the child as the teeth come up?
Yeah, teething is definitely true. Many parents will tell us, and they'll be screaming right now, teething is very, very real. And the reason it happens is because of that thick gum that the teeth have to push through. So, yeah, it can cause pain, drooling in children, sometimes fever in kids as well. So there are a few things that little one will have to go through during those early years.
It seems so cruel, doesn't it? That we're not, I'm glad from a mum's perspective that babies aren't born with teeth. Oh, but they can be. So in my mother's group, one baby was born with a tooth, and guess what? The dad was a dentist.
Oh, no way.
Had to get the tooth taken out.
Oh, wow.
Breastfeeding.
Yeah. So I am glad for us that they're not usually born with a tooth.
But can be.
But I do feel really sorry for them that they have to go through that experience, because if you think of anything breaking through, skin, it just must be awful. Can you talk to us about the order that the teeth come in? So you said the 2 front teeth first, then what happens and at sort of what stage?
Yeah. So the easiest way to think about it is teeth emerge front to back. So the lower teeth often come earlier, so it'll be the lower front teeth followed by the upper front teeth, then the middle teeth, and then finally the back ones. And they usually come through at about age 2 to 2.5, and we find that as you progress towards the back, those teething pains begin to rise up as well. So it only gets better and better.
Oh, I know. I still remember my little one waking up in the middle of the night getting the molars, screaming like terrible nightmares. I thought he suddenly got nightmares, but then lo and behold, I'd gone to fantastic Alex, and he's like, no, he's just getting his molars, and he was. And then the nightmares went away. It was really just the teeth coming through. Wow. So, Alex, they get their teeth in that order. How do they lose their teeth?
So the teeth are generally lost in 2 sets. So we find that particularly for girls, they start off a bit earlier than boys, but anywhere around age 5 to 6, we begin to lose the lower front teeth, and then the upper front teeth follow suit. Nothing happens for a few years, and parents sometimes wonder what's going on, why aren't they losing their teeth? Perfectly normal. Once they get to age 9, 10, 11, suddenly all of those back teeth start flowing out as well. So you've got 2 high intensity periods that you need to watch out for, and bearing in mind that some adult teeth come through without pushing baby teeth out as well. So at age 6, the molars come through at the back. That teething pain comes back as well, and it's usually a big concern for parents when, little one says, oh, my gums hurt, I can't eat. Have a look in their mouth, have a look at those back teeth, and you can see those little bulbs pushing through. It's perfectly normal. It's just, again, that whole teething process resuming again.
So how old are you when you finish losing all of your teeth and you have all your adult teeth?
Look, in a perfect world, we tend to see all the adult teeth coming through at about age 12 to 13, with the exception of our wisdom teeth, of course. They come in our later teenage years. Girls, again, they tend to develop earlier than boys dentally, and sometimes I've seen 10-year-old girls with a full set of adult teeth. Boys sometimes can be as late as 14, all within the realms of normality, generally nothing to panic about in their development. Yeah.
How do we clean a baby's teeth? And is that something we have to do?
Yes, you definitely have to clean their teeth. Perseverance is good. Babies' teeth are hard to grip onto, and the books tell us use a kid's toothbrush, but I find the easiest thing is just to get a clean cloth that you can grab onto, especially those little front teeth that are maybe only halfway through. Just give them a good wipe. No toothpaste, nothing fancy, just scrape the plaque off and then leave it at that. 18 months onward, that's when I would introduce a children's toothbrush and children's toothpaste as well. Just a small amount is enough.
And when should we be getting our kids to clean their own teeth or having a go ourselves?
So children should be able to start doing some kind of cleaning by about age 5, I would say. And it's important for parents to just get involved and do what I like to call a handover technique. Let the little one start, but then you finish the job, especially in that nighttime clean when they're not going to be exposed to anything for the next 8 hours. That's a really big one. By about age 8, I would say children should be independent enough to clean their own teeth. There are things that you can do to help them as well along the way. There's apps, there's timers, music. You've got to try and make it fun. Got to try and get them involved as well, definitely.
What would some of your tips be for how to teach your child to do it? Is it demonstrating with them, or how do you suggest you start that handover process?
Yep. So I think, first of all, routine is important. So we know that brushing is going to be a normal thing before bedtime. So they know bedtime's coming up. I know I need to brush before then. So routine is important. Definitely the adage of tell, show, do works here as well. If you're going to do it with the little one, do it together, make it fun. And if they see you doing it, then they will follow suit. Siblings can be invaluable as well, especially for the little ones, who look up to older brothers and sisters. They will want to do the same thing. Get them involved as well. You can also, download apps that help you. An example is the Colgate Tooth Defenders app. There's all these superheroes, they sing a song, it goes for 2 minutes, and there are animations that will take kids through it. So just use any tool you can, but routine is essential for them.
Yeah, I was quite shocked to hear that you're supposed to clean their teeth for 2 whole minutes. It doesn't sound that long, but that is a long time when you've got a kid that you're trying to get to every single.
And presumably that's not when they've only got 2 teeth.
No.
You're working up to really when you've got, when you've got a full set. Initially it is just that white clean, and then once you've got a few more.
That's right. 2 minutes once they've got all of their teeth. Yeah.
And is electronic toothbrushes better than a manual toothbrush? Or it doesn't matter?
Look, the jury is still out about that. I find that electronic brushes are simpler to use. You don't need as much manual dexterity for electric brushes, but the flip side of that is that for kids who are more sensitive to certain stimuli like vibration or sound, that might put them off. It might actually be a little bit scary initially. They might feel like they don't have as much control. So I would say stick to a manual brush, definitely before the age of 6, I would say is the easiest way.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
What about flossing?
Flossing is tough. Even for us, even for everybody, who know they should be flossing. But getting kids to floss is very difficult. We find that once the back teeth are through, there is enough contact between those back teeth for food to get stuck. So there are products that parents can buy for children, chiefly floss sets, and they come in different colours. Sometimes they have animals on them, and they help to make it fun. It's tough, but if you can try and make a game out of it, and as disgusting as it might sound, like how many bits of food can we find tonight, or something like that. Something that the kids are going to have a laugh at, and something that gives them a level to try and achieve. You're counting with them. There's some kind of mark that they're trying to meet, and you can have a laugh along the way, I think is the best way.
Yeah, I used to do toothy tales. So each tooth told a tale about what they did today. And it was my way of getting them to tell me what they did that day. So I'd go, oh, let's see what the molar's got to tell me. They'd be like, oh, the molar said you did maths. I didn't do maths. Or my molar said that you ate something at lunchtime. Maybe.
Yeah.
I see chocolate here.
Yeah, that's right. I didn't give that to you.
And it sort of let me get around for the 2 minutes to get it to all of the teeth. So let's talk about going to the dentist. It's so less scary than when we potentially were kids ourselves. I know my kids come to you and you're so brilliant. You make it so fun. They actually love coming to the dentist. But when should we start to take our kids to the dentist?
So generally we recommend age 3 to be appropriate for kids. Anything before then, you're not going to get too much out of them. And at 3, they should have enough maturity to be able to sit, often with mum or dad in the chair. My big tip for the first dental visit is in the car ride there, don't say the words, it's going to be okay. As soon as you say it's going to be okay, you've lost them. Kids are so sharp these days. So try and psych them up. Try and, make it look like it's your first dental visit. You're finally old enough to take a ride in the big chair. You're going to get your prizes. We're going to count your teeth. It's going to be the best thing ever. So it's really just a rite of passage for them rather than something that's mandatory and enforced onto them as well.
Yeah. And Christiane Cahoe, our amazing emotion coach expert, talks about role playing, like get your teddies out and pretend you're going to the dentist and how fun it is and how counting the teeth. And she thinks that really helps her little kids do that. Yeah.
What about cavities? I think it can be incredibly guilt-inducing if you find that your little one has a cavity when, you've been really diligent with their teeth brushing. Can you talk to us a little bit about what causes them and what we can do as parents to prevent them?
Yep. So cavities form because of bacteria that's been processing refined carbohydrates. And the byproduct of that is acid, which weakens the enamel, causes the teeth to break. So most of us know that sugars aren't fantastic for teeth, but the hidden dangers really also come from our sticky, starchy foods. White breads, rice crackers, biscuits, those kind of things that really sit on the teeth, the bugs will love. To prevent all of that from happening, to have a good diet for kids, try and incorporate fibrous, crunchy foods that have a high water content. Your raw carrots, apples, pears, they will physically scrape the teeth clean and remove that plaque. Additionally, introducing foods that have good fats in them, like your nuts and cheeses, will help coat the teeth in a layer of fat. It actually prevents bacteria from adhering to them as well. So diet, I find, actually trumps oral hygiene in the early years. It's the most important thing for kids. Yeah.
And also too, I think like what you're saying is a lot of parents don't realise that sugar's in bread. Things that we didn't have sugar in when we were kids, they've got sugar in everything now. And when they packing that lunchbox, it's about thinking about how long it's going to stay on their teeth, how sticky it is, because you can get a bit of a shock when you think, oh, I'm giving them a healthy muesli bar, but it's like got sticky honey, or people might not think about those sorts of things, or they're giving them sultanas thinking they're giving them a healthy treat, but it's got like sugar in it that gets stuck between their teeth.
Yeah, that's right.
What about childhood injuries for teeth? Both of us have had kids that have had injuries. My little son actually chipped the corner of his teeth. Alex, I need to come see you on the weekend. And it was so, it was, of course, it was just an everyday thing. Freya's when her son was just running along, fell over and hit his teeth. He was actually just bouncing a basketball and it hit him in the head, and he bit down onto his teeth. It's so easy to happen. What should parents know if their kid does injure their tooth by like breaking it or chipping it? What should they do?
Yeah, so it's stressful. Definitely, as hard as it is, try not to panic. The first thing that you should do is try and just assess the situation. Is there a lot of bleeding? And can we get it under control? Can we use something clean to just stop any bleeding that might be there? If a piece has actually fallen out, don't try to think about whether it is an adult tooth, a baby tooth. Just grab that piece as well, because the dentist will make a judgment call as to what can be done, if anything needs to be done. When we're panicking, sometimes it's hard to, we freeze up and it can be difficult to make those judgments. So just get that piece, take it to your dentist. Now, if you have seen that a whole entire tooth has fallen out, which can happen, particularly, in contact sport, then the number one thing that can help save that tooth is for mum or dad to actually spit out a bit of saliva into a container and put the tooth into that saliva, and that will preserve it. And try get to your dentist within an hour so we can put it back in. And it can actually regrow in the mouth if it is a developing tooth. If you're looking after somebody else's kids, if you're babysitting and you can't do that, the next best thing is cold milk. Put that tooth into some cold milk, try get to the dentist within an hour. After an hour, the chances of that tooth surviving start to decrease rapidly as well.
What happens if they hit their tooth up into their gum or down into their gum?
Yeah, so two things can happen. One is the tooth can fracture, or the tooth can actually be pushed in to the gum as well. So that's why I tell parents that even if there is a small piece that comes out, take it, because the dentist can use that to ascertain what kind of injury has actually happened. Has the tooth been pushed in, or has it completely sheared off as well? In instances like that, if it's a baby tooth, there's not much that we can do. We try and just stabilise the wound and, after that, monitor the area. If it is an adult tooth, then sometimes we can actually rebond the piece to that remaining fragment that's there as well.
I was shocked to hear that. I didn't know that, when your son Rupert broke his teeth. I didn't realise that you could actually stick them back on if they were broken. I thought you just have to get a cap.
Yeah, and we put the pieces in milk, which we were told to do, which was really great as well. So that was exciting. That it all was not lost, and now you can't even tell.
No, you can't tell. You can never tell.
Yeah. Oh, Alex, thank you so much for sharing your words of wisdom with us today on the Expert Guide to Parenthood podcast.
My pleasure.
Dentists, and dental visits can sometimes be shrouded in mystery. We can put them off, but there's no need to, because they really are, like you say, a rite of passage for little kids, and getting them into good habits early is so important. So thank you very much for your advice today.
Thank you for having me.
A huge thanks to Mistela for sponsoring this episode. When we become parents, we welcome any tips and tricks that can make our lives easier. With Mistela's skincare range, you can have peace of mind knowing that they're specially formulated to be suitable from birth for babies and children. Each Mistela product undergoes 450 safety tests and measures and is dermatologist and paediatrician tested. Mistela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast. We've got over 100 episodes of all different parenting advice there for you, so check it out if there's a topic that you're interested in, or send us a message and we'll try and get an expert in to answer your question. You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.